Hey everyone, my name is Amber Blackford and this is my senior practicum project. I did my project on improving patient satisfaction related to hourly rounding. So before I get started with my actual project, I'm just going to go a little bit into the patient satisfaction aspect. So everybody needs patient satisfaction, whether you work in a hospital, a facility, a clinic, anything. For better patient satisfaction, it's always important um, to make sure that you care for the patient themselves. So, of course, better patient satisfaction always leads to better patient outcomes. They recover faster. More patients in revenue. So, patients who get great care will tell their families and friends. And then, if someone's hurt, they will be more likely to go back to that hospital or clinic. Less malpractice risk. I know everybody hates hearing that malpractice word, but if a patient is more happy, they're less likely to sue if something was to go wrong. And of course, the nurse or person taking care of the patient, it's always important to ask lots of questions and listen. Patients always enjoy that. So like I said, my project was actually for hourly rounding. So at my hospital, my unit, my manager is very big on patient satisfaction. So they had been talking about implementing hourly rounding, but my manager just wasn't really sure how. So for my project, I came up with a way to try to implement it. So the benefits of hourly rounding, of course, is to improve communication. So you're able to see your patient every hour. Of course, if it's not you, then it's the care partner, physical therapist, or doctor, which is always important in case they have multiple questions pretty much around the clock. Hourly rounding definitely helps reduce falls. A patient could not have their bed alarm on, or the side rails could be down. So that's something that a person can check, a staff member can check and make sure every time they go in the room. It reduces the call lights. So if you're in there asking, if you're checking on them every hour, they won't be on the call light constantly asking you to come in or bring you water because you've already checked on it. It reduces skin breakdown because, like I said, if you're in there, then you're able to rotate them at the normal every 2-hour mark to reduce the pressure injuries from them just laying in the bed constantly. And of course, hourly rounding makes employees happy. So if you look back, it reduces the call lights. So a nurse doesn't have to be constantly hearing the call bell go off. If you're just in there checking it, then you don't have to hear the call bells. So my learning objectives for my project were first, I just wanted to analyze the current factors in improving patient satisfaction using evidence-based projects in the literature. So I looked up a few different evidence-based projects that were on our library, and I kind of compared them to what we were already doing, just in rounding in general. And then what I did is I implemented a new patient satisfaction care plan to the nursing unit. I did a 3-week period. It was 2.5. It kind of ended up being 3 weeks in the end. And I'll go through exactly what I did on the next slide. And then, of course, for learning objective 3, I just evaluated the progress of my nursing staff just to see the outcome and how it all got put into place. So for hourly rounding, I came up with this sheet, pretty much just for the RN, the LPN, NTP, whoever went in the room during the shift, to just kind of put their initials down, say what they did, or if the room was empty, anything like that. I wanted to make it very simple. Sometimes the days are just so busy, you get one thing thrown in on you and nurses just kind of scramble, Lots of us just don't like change. So with this, it's just very simple, to the point, at the time, sign your name, put what you did. So, you gave a bed bath, you took them to the bathroom, a nurse passed medications, very easy. And then you just kind of go down the line pretty much your whole shift, 7 to 7. And then, night shift doesn't have to go in every hour. So I made it every 2 hours. So by doing this, the nurses actually ended up liking it. They saw a reduce in the call bells. My manager was actually able to pull up the call bell use in a 3-week period, and she saw that they were used a lot less than normal. There were no reported falls in the 3-week period. So that was nice. I don't know if that was just a coincidence or if we really did do a good job with the hourly rounding. And then my manager and my project mentor also stated that she pulled up a month-long satisfaction score and she noticed that they increased from 74.6 to 89.5 in a month period. So in the time that I did my project, our satisfaction scores went up. So because of that, my manager wants to keep implementing these hourly rounding and see what sort of changes we could do just from this project. So I think it turned out really well. So in conclusion, hourly rounding is beneficial for patient satisfaction. So like I said, it's good for communication, reduces falls, reduces the call bells, helps nurses and care partners be vigilant in their care. So they're not just going in there and just kind of, checking vitals and leaving. They're able to go in and communicate with the patient. And then if you have those patients that come in and they don't really need a lot of care, they don't have a lot of medications, normally you wouldn't be in there that often, but this way it can make the patient feel important even though they don't need a lot of stuff. And last but not least, I think that this project went very well. My project mentor was very happy with the results of this, and now my manager is loving it, so we're keeping it in place. So I think everything went well, and we increased our patient satisfaction scores. These are my references that I used. Thanks for watching, guys. Hope you enjoyed.